How many hours did you spend developing evaluation tools this week? I want you to take a minute right now to reflect on the tools that you developed, whether they were exams, discussion boards, or maybe even a quiz. So I want you to calculate right now, how much time did you spend developing those tools? And then the second step I want you to take in the reflection is, were they effective? Did they achieve the objective that you expected them to, which is ultimately to validate that learning has happened? Welcome back, everybody, to Dr. Sellers Educate. We're excited that you're back. We're continuing to explore different elements related to evaluation and assessment. We spent a lot of time developing content with our various teaching strategies to really engage students in the learning process. And ultimately, we want to be able to create valid tools that are also going to help us feel more confident in validating that learning has happened. How many of us, unfortunately, don't always see the correlation between the time that we invest in developing our lesson plans and these incredibly engaging learning activities and the ultimate outcome, which is ensuring that learning is actually happening? Well, we're continuing on this journey of achieving nurse educator excellence. We also want to support you with ease. Okay. And what that means is using tools that are already out there so you do not have to reinvent the wheel. That's part of what our mission is, too. We want to maximize the time that you have to focus on content and resources that are ultimately going to help you achieve nurse educator excellence and to also help you achieve that passing score on the CNE, the CNE clinical, or the CNE novice exam. We continue to have anywhere between a 95 to 100% success rate. Sometimes it's 97, sometimes it's 100, right? We track that data based on self-reported information from colleagues. So definitely keep us posted as you move forward on your journey. All right, two steps we want you to take before we dive into our content. So first and foremost, we want you to go ahead and print out the study worksheet that's listed right here in the description. And then the second step we want you to take is to pull out Billings and Halstead Teaching and Nursing. We're still in the 6th edition, and this is because the exam writers told us, now it's been a year ago, in 2023, that these were the only two resources they used. First of all was Billings and Halstead, and then the second resource was Dr. Caputi. And there was a third resource that they mentioned, and that one was one that they used to write the exam questions, but we embed that content into our masterclass curriculum and into our self-paced curriculum. So there are no other resources you have to buy other than Billings and Halstead, as well as Dr. Caputi as an optional resource. All right, so the specific page numbers, let's go ahead and go over those now before we jump into our content. We want you to look at chapter 16, okay, in Billings and Halstead. This is going to give you a great summary of various evaluation tools that really align with the evidence that we're going to talk about and touch on in the snapshot. The second resource we want you to go ahead and pull out in Billings and Halstead or turn to is going to be table 14.1. Okay, this is an excellent resource. Now it's in the 6th edition, but it is not in the 7th edition. So if you're looking for it in the 7th edition, unfortunately, they edited that table out. However, there's still content in the 7th edition that will help you close your knowledge gaps. We also have a crosswalk right here from Elsevier between the 6th edition and the 7th edition. So take advantage of that as well. So again, you're not wasting time plundering through the 7th edition trying to find the content that we're talking about. Just go ahead and use the crosswalk. And then the last resource in Billings and Halstead is going to be pages 188 through 190. And this is going to help you stay grounded in the content related to cognitive learning domain. All right, so hopefully on your study worksheet, you've already put the date, whatever date you're watching this snapshot. The second area you want to fill out is the objective. So what is it that you want to achieve today now that you know a little bit about what we're going to be discussing? And then the third step is to write down those page numbers I talked about. So chapter 16, table 14.1, and pages 188 through 190. Okay, these are all resources that are going to help you close your knowledge gaps. Okay, so let's jump into the content for our time together today. And if you have not had a chance to watch the previous snapshots where we were talking about exam analysis and the 5 steps you should follow to ensure that you are following evidence-based practices as you think about the exam development as well as the exam analysis, right? Both steps are equally important, and we want to maximize our processes that we're following to ensure that they are aligned with the evidence. And ultimately, that helps us feel more confident and competent in the tools that we are developing for our students in order to validate that learning has happened. So here's our question. When we talk about validation of learning, how do we effectively assess and evaluate? And then that second part of it is, how do we align it with learning theory? Okay, that's what chapter 16 is going to give you some more information about. And then you're going to take a look at chapter or table 14.1 to really close the loop as it relates to some of these content areas that we're going to talk about. And then when you look at the actual Hallmarks of Excellence model, this is a great resource as well. Now, we know that there are 8 competencies, right, for the C&E exam, as well as C&E novice, and then there are 6 competencies for C&E clinical. Each of these competencies are well aligned with the actual Hallmarks of Excellence model, and you may wonder, well, how is that related? This model that was developed by NLM, you can see that it's copyrighted by them. So go to nlm.org website and you can do a search for Hallmarks of Excellence. And this model really does describe what elements should be considered and included in our actual nursing program. So that's the difference and really the correlation between our competencies and this Hallmarks of Excellence. We develop content here that is going to help you stay focused as you move forward on your journey. And we always like to draw those connections in case you have questions. All right, so let's take a look. So the 2 that we're going to focus on in our time together today are innovative evidence-based approaches to facilitate and evaluate learning. So here's the question. What type of innovative approaches have we incorporated into how we evaluate our students? What does the evidence say? What does chapter 16 say about those tools that we are using? And then the next step is whether or not the tool is effective with our student population. We know that there is a diverse type of student in our room consistently. Sometimes we have 3 generations in our classroom. Sometimes we have English as additional language students in our classroom. And even think about the diversity of how we all learn as adults, right? It's very different depending on the content sometimes and depending on my preferred learning style. So that's what you want to consider. What are those innovative evidence-based evaluation strategies that I'm using in my classroom, and are they effective? Are they working? And then the other key hallmark we're going to explore as it relates to the content in this snapshot is resources to support our program goal attainment. So we want to engage the academic and our community partners. We want to prepare students for technology. We want to bridge that theory practice gap with our students as it relates to the evidence and thinking about Boyer's 4 dimensions of scholarship. You can take a look at pages 8 through 10 in Billings and Halstead if that's a muddy point for you. But ultimately, what this hallmark really talks about is, how do I leverage the resources I have in order to maximize the learning experience with my students? Let me give you one example. When it comes to ATI, they're a wonderful partner for so many nursing programs across the country. How can I make sure that I am using all of the great resources to the fullest extent so that my students, first of all, can get the value, right, that they have paid for that great program? And then second of all, how can I integrate it into my curriculum? I already know that wonderful nurse educators with the ATI team have done their due diligence. They've developed strong curricular elements. So now the next step is, how do I integrate them? So am I using my resources to help me achieve my program outcomes and ultimately to validate for my student that they are practice ready? How do I do that? What tools am I using? And what opportunities do I still have to improve the program outcomes of my nursing program? All right, so let's take a look at our thought-provoking question and see what you think about this one. When implementing formative assessment techniques to improve student learning outcomes, which of the following best exemplifies an evidence-based approach that balances student engagement and knowledge retention while aligning with the NLN Nurse Educator Competency 3? A is using ungraded in-class quizzes to encourage content review. B is integrating peer assessment activities where students review each other's work based on a detailed rubric. Or C, administering a high-stakes cumulative exam mid-semester to identify areas of improvement. All right, so I'm going to give you all a few minutes to kind of think about the two steps we like to follow. First step is to consider, what is this question really asking me? And then second of all, what is it that I know for sure about content related to this question? Okay, so I'll give you all a second to think about those two questions that you're asking yourself. And then we're going to take a look at the answer as well as the rationale before we close our time out together for this snapshot. All right, so let's keep going. Now we want to kind of close the loop, right? We open the loop by starting our conversation in this snapshot talking about the importance of developing valid and reliable tools. And we reflected on what tools have we developed, what tools are effective, and what opportunities do we have to make our evaluation tools even more effective as we move forward. Constructivism is the theorist that we're going to align with evaluation strategies during this snapshot. And this is Jean Piaget. And did you know constructivism is a branch of cognitivism? Well, when you think about it, it makes sense, right? Because constructivism is all about how do I put the pieces together? How am I closing the loop for my students in a way that they're walking away with a solid comprehension of these concepts? And ultimately, we want our nurses to be able to reach that application and analysis level and creating even so that they are putting those pieces together and they're using their clinical judgment skills and making safe patient care decisions. What else do we know about constructivism? Well, it is all about creating and constructing, right? Constructing those thoughts based on my prior experiences, even the knowledge that I've had in the classroom. So I am bridging that theory practice gap because I'm thinking about, what did I learn? What did I hear about as it relates to sterile technique on Monday? And then on Wednesday, I'm in lab. I'm actually practicing sterile technique. And then maybe in the following week, I am in the clinical setting and I have a chance to actually insert a Foley catheter or make or integrate the sterile technique process when I'm doing a wound change, okay, or a dressing change. So that's what you want to think about. How, as an educator, can I integrate these learning theories and the rationale for me using the different evaluation strategies and making sure I'm closing the loop and I can see the connection between these learning theories and these actual examples of teaching strategies. On the C&E exams, it is all about application and analysis, right? Especially with the C&E clinical, because we have to be able to apply these wonderful concepts that we're learning about in a way that we're able to reach that passing threshold on the C&E exams so that NLN is confident that I am indeed competent in these areas based on how I've been able to answer these questions. So 70 to 80% of the content on the C&E exam is going to be at that application and analysis level. And even more than that for the C&E clinical when you take a look at the behaviors listed under those 6 NLN competencies for C&E. What are the specific evaluation and assessment tools I'm using that are aligned with constructivism? So we have essay exams, portfolios, peer feedback, and teaching. These are such important examples of how we can integrate constructivism because you think about it. I am reflecting on the prior experiences that I've had, especially as it relates to a portfolio. With peer feedback and peer teaching, this is a social element because I'm observing a peer, right? I'm partnering with a peer to deliver content in the actual classroom, the skills lab, or even in the clinical setting. Now, most of our content that we have aligned in this snapshot is related to the cognitive learning domain. So go ahead and write down pages 188 in Billings and Halstead. You want to go back, take a look, be clear about the different levels of the cognitive learning domain. And you also want to know the verbs. You want to know the teaching strategies at every level, because that's our goal, to integrate a variety of teaching strategies into our classroom experiences with our students so we can connect with all different types of learners. And then debrief and reflection. So this is your chance to kind of write down, what are some of your muddy points that you may still have? What are some strategies that you're going to use to move forward with ease on your C&E journey? And we call it a journey for a reason. During our recent masterclass, one of the colleagues said, I like that you all call it a journey, because that's exactly what it is. It took me almost 8 years to get C&E off of my bucket list. And the two primary reasons, because I didn't know where to start. And then second of all, I really didn't have colleagues that were willing to go on this journey with me. And we don't want that to be you, right? We don't want it to take 7 or 8 years, even though we're here to support you until you are successful. So take some moments to debrief. What are you walking away with today that you didn't have at the beginning of our time together today? And then reflect. We want you to think about what are some specific evaluation strategies, assessment tools that you're going to use and integrate right away. Research tells us we can be at that 90% threshold of retention when we're able to immediately integrate a teaching strategy or to teach it. Okay, so we encourage you to identify what's just one tool that you're going to use that we've talked about that's described in chapter 16, and you're going to align it on table 14.1 with the learning theory that you're going to integrate over the next, let's just say 30 days. Okay, that's what we want you to do. Okay, so thought-provoking question as we wrap up. B is the correct answer. Integrating peer assessment activities where students review each other's work based on a detailed rubric. Okay, so how many of you chose the correct answer? Go ahead and put it in the chat if you're live. If you're watching this when it didn't launch live, then still put it in the chat. We want to hear from you all. Did you get the answer correct? If you did, congratulations. If you didn't, here's the good news. This is a thought-provoking question for a reason. We don't write questions for NLN. That would be a conflict of interest. This is simply an exercise to start generating some of those thoughts that we want you to consider on your path to C&E success. Okay, so think about, why is it that I didn't choose the correct answer? What attracted me to the distractors, which would have been A or C in this example? All right, so that's what we want to talk about now. So the rationale for B being correct is related to the fact that peer assessment with the rubric-based guidance allows students to engage actively in evaluation, providing opportunities for immediate feedback, critical thinking, and self-reflection. These are all really important traits for formative assessment, and it is most closely aligned with NLN Competency 3 for the C&E, which is all around emphasis on evidence-based assessment to enhance student learning. Now look at that last part. Now, let's be honest. How many of you were aware or even think about evaluation and assessment tools, the goal being that we are able to evaluate student learning, right? That is our goal, that we want to partner with our students on their learning journey. And the best way to do that is to have checkpoints along the way. You know, I like to correlate much of our journey to a navigation system, right? So when we get in a car and we're going to somewhere that's unfamiliar, we don't just start driving, right? We want to get there as quickly as we can and as safely as we can. We have tools, resources to help us do that, our navigation system. So we want to put in, where are we headed? Where are we going? Well, it's no different with our students. Competency-based education talks about beginning with the end in mind. What is the end goal? Yes, we want students to pass the exam, but most importantly, we want learning to happen. We want to be able to align those learning objectives and truly validate that they have been accomplished. Okay, so that's how you want to think about it as it relates to this thought-provoking question. Our goal with formative assessment tools is that we're enhancing the learning experience with our students. We're even giving them cues about content that they're not as knowledgeable about as we need them to do, as we're taking them on that formative assessment journey. Remember, formative is all about forming the learning. It is for learning. Okay, I know students don't always feel that way, but as an example, adaptive quizzing is a wonderful example that we can integrate as far as a formative assessment to really collaborate, partner with our students so that they are clear about content that they are knowledgeable about, and they also have a stronger sense about content that they're not as knowledgeable about. All right, we hope that this snapshot has been helpful, and we look forward to seeing you during the next one. Reach out if you have any questions. Info@Dr. Sellers Educate. We look forward to seeing you in our next snapshot. Have a great one, everybody.